Hospital pharmacy. Hospital pharmacy is the healthcare service which comprises the art, practice, and profession of choosing, preparing, storing, compounding, and dispensing medicine and medical device, advising healthcare professional and patient on their safe, effective, and efficient use. Hospital pharmacy is specialized field of pharmacy which form an integrated part of patient healthcare in health facility. Hospital pharmacy is the profession that strives and continuously maintain and improve the medication management and pharmaceutical care of patients to the highest standard in a hospital setting. Hospital pharmacies provide service and patient and healthcare professional in hospital.
Many hospital pharmacies still perform the traditional pharmacist role. They fill doctors' prescriptions, compound or mix drugs, plan and monitor patients' drug scripts, enter information into a database so nurses can access it, determine the success of prescribed medications, and advise patients how to take their medications during and after their hospital stay. Overall, as Purdue University points out, hospital pharmacies are responsible for systems which control drugs distribution and ensure that patients receive the right medications in the correct form and doses at required time without causing the patient adverse reaction. They can advance to supervisory positions or administrative jobs in areas such as finance, personnel, and system development. At hospitals connected with universities, pharmacists may spend some of their time in education of physicians and other medical professionals about drugs and their uses. It is pointed out that some of pharmacies give lectures to local schools of dentistry, medicine, nursing, and pharmacy. Pharmacists employed at university hospitals may also participate in the university's research projects. The medical centers reports that some overseas pharmacists have been involved in designing studies on humans to ensure that they adhere to all applicable laws and regulations. After qualifying as a hospital pharmacist, you will be required to aid other members of healthcare staff as well as patients within specialist areas. This may include pregnant or breastfeeding women or those with chronic conditions affecting their heart, liver, or kidney. For these more complex cases, hospital pharmacists are required to use their adept communication skill to find out more information on the patient and eventually comment to a qualified decision over the best course of action. Factors such as a medical history, lifestyle, existing medication, beliefs and wishes of the patient, and their ability to understand and follow an individual treatment plan are all important to investigate ahead of dispensing or prescribing medication. As with any healthcare job, it is important to stay up to date with all aspects of medicine, their usage, and new developments. In order to do this and remain a good source of paramedical advice, it is essential that you use electronic databases and read research papers. These provide invaluable sources of information and allow you to learn more about new drugs before recommending that they are purchased by your hospital.
Clinical pharmacy. Clinical pharmacy is defined as an area of pharmacy concerned with the science and practice of rational medication use. Clinical pharmacy is a health science discipline in which pharmacists provide patient care that optimizes medication therapy and promotes health and disease prevention. The practice of clinical pharmacy embraces the philosophy of pharmaceutical care, blending a caring orientation with specialized therapeutic knowledge, experience, and judgment to ensure optimal patient outcomes. As a discipline, clinical pharmacy also has an obligation to contribute to the generation of new knowledge that advances health and quality of life. Clinical pharmacists often work in collaboration with physicians, nurse practitioners, and other healthcare professionals.
Within the system of healthcare, clinical pharmacy are experts in the therapeutic use of medication. They routinely provide medication therapy, evaluation, and recommendation to patients and other healthcare professionals. Clinical pharmacy are a primary source of scientifically valid information and advice regarding the safe, appropriate, and cost-effective use of medication. Clinical pharmacy are also making the safe more readily available to the public. In the past, access to a clinical pharmacy was limited to hospital, clinic, or education institution. However, clinical pharmacy are making the safe available through a medication information hotline and reviewing medication lists, all in an effort to prevent medication error in the foreseeable future. In the United Kingdom, clinical pharmacy are routinely involved in the direct care of patients within hospital and increasingly in doctor surgery. Clinical pharmacy interact directly with patients in several different ways. They use their knowledge of medication including doses, drug interaction, side effects, explain effectiveness to determine if a medication plan is appropriate for their patient. If it is not, the pharmacy will consult the primary physician to ensure that the patient is on the proper medication plan. The pharmacy also works to educate their patient on the importance of taking and finishing their medication.
Clinical pharmacists are the go-to people who help patients recover from illness or maintain a healthy lifestyle. The doctor makes the diagnosis and prescribe medication in a general form, but the clinical pharmacy helps make specific decisions. For instance, if a patient is having an adverse reaction to a specific medication, the clinical pharmacist will suggest alternative therapies. The clinical pharmacist will also help select the best combination of drugs for a patient condition.